Welcome everybody. Thanks for joining us tonight. My name is Drew Contreras. I am the American Physical Therapy Association Vice President of Clinical Integration and Innovation. And what does that mean? Not much right now. It just means that I'm the one moderating this call today because you guys are all here to hear some great knowledge from two amazing speakers today. Just a little bit of programming notes for you guys. Today's programming is brought to you by the American Physical Therapy Association Fit for Practice campaign, a national campaign directed at the physical therapy profession, powered by our partner Hyperice. The intent of the campaign is to deliver programming for you guys, the PT profession, PTs, PTAs, clinicians, clinic assistants, front desk workers, whoever you are, whatever you need. We're trying to help you guys out as we are all trying to figure out what our new normal is, right? Today, special treat for you guys who have come in. If you're getting this recorded after the fact, feel free to make sure you share this with your friends and colleagues, because this is an important conversation we're going to have today about who's helping us as the healthcare providers, right? So two great speakers for you guys today. I'm going to introduce them and I'm going to back out. I'd ask you guys to stay on mute the whole time. If you have a question, you can drop it in the chat. We'll moderate those questions as we go, and then we'll get this thing going today. So first speaker tonight is Kevin Wilk, a literal PT goat for us out there, right? Kevin has been a physical therapist, researcher, and educator for over 32 years. He's currently the Associate Clinical Director for Champion Sports Medicine, a select medical facility in Birmingham, Alabama. In addition, he is the Director of Rehabilitative Research at the American Sports Medicine Institute in Birmingham and is Adjunct Assistant Professor in the Physical Therapy Program at Marquette University in Milwaukee. Kevin is also the Rehabilitation Consultant for the Tampa Bay Rays baseball team, and he's worked with the Rays for over 18 years, and Kevin has worked with professional baseball for over 29 years. So, a mediocre resume at best. Joining Kevin is Dr. Brett Mccabe. Dr. Brett Mccabe is a licensed clinical and sports psychologist and founder of The Mindside, a performance consulting organization. Dr. Mccabe is also the sports and performance psychologist for the University of Alabama Athletic Department, providing services to all sports. Dr. Mccabe holds a PhD in clinical psychology from Louisiana State University and completed his 12-month psychology internship at the Clinical Psychology Training Consortium associated with the Warren Alpert Brown Medical School in Providence, Rhode Island. So, gentlemen, thank you very much for joining us today. I am by far the least accredited person to be having this conversation, so I'm going to back out of here, let you guys have this conversation. Thanks again, everybody. I hope you enjoy this today.
Thanks so much, Drew, and thanks for that kind introduction. And certainly the expert is Dr. Mccabe, and we're really pleased to have him this evening joining us. His expertise, I'm sure you'll enjoy. So thank you so much for joining us today and discussing this very important topic, mental health issues in the healthcare profession. When we talk about the pandemic, I think it's taken its toll as healthcare providers. We're definitely perhaps more stressed, maybe a little bit more burnout, maybe a little bit more fatigue, and a little bit of uncertainty. So we're going to focus this evening on strategies to help deal with some of these issues that we're faced with on a daily basis. I thought we'd discuss three specific areas of mental health wellness for PTs, PTAs, and as Drew mentioned, other healthcare providers. One will be the daily practice of physical therapy. Two will be the career of physical therapy, in other words, our longevity. And third will be our personal life. So as you may know, Dr. Mccabe, PTs have the disease to please. We never say no. We always have a positive attitude. We're always trying to help people. But the question is, who's taking care of us? Because we certainly can't take care of others if we're not taking care of ourselves. So the first question I'd ask you to discuss a little bit, Dr. Mccabe, is strategies for us as physical therapists and other healthcare providers dealing with long-term types of problems in the daily activities, such as hard, difficult days, scheduling issues, payer issues, limited visits, trying to communicate with physicians and so forth. What can we do on a daily basis? And what I mean by that is perhaps what can we do at our lunch break or at the end of the day so we don't go home kind of angry, frustrated, or trying to kick a dog when we get home, which I don't want to do.
No, don't want to do
at
that.
any cost.
No, we don't want to do that. And thank you for having me for this. And I will say one of the aspects that I've worked as a clinical psychologist for many years is in the medical setting and working in PT offices and working in physical medicine and rehabilitation, chronic pain. And so when you work with the providers in those settings, many times there's a frustration that tends to build up of dealing with chronic patients who may not have immediate return or are having to deal with their own frustrations. And all of us got into this industry because ultimately we're engaged with individuals to help them in some form or fashion. And so we tend to be emotionally connected to them. And over time, that wears on us emotionally. And then you start taking the 8-hour day and making it a 9-hour day over 5 days, and then a 10-hour, then an 11-hour. And then all those daily hassles that we have to do outside of our direct patient contact that just seems to get added on that doesn't really get accounted for, but it's a responsibility that we have to live up to, whether it's notes, certifications and meetings and administratives. One thing we have to realize is that there's two types of stress that we have to deal with. The first kind is what we call major stress. And major stress are those factors such as, COVID was a major stressor, somebody getting ill in your family, you dealing with a major life issue or life change, something that takes up your tremendous amount of your resources to have to respond to. And we know that those often wear us down. And you've seen the studies where people will, get very tired or exhausted afterwards. But the slow, painful process is those minor stresses. And those minor stresses are important because it's not that they require a big response. So one thing you have to understand about stress is just like in physics, it's anything that requires a response to it. And it's any kind of force, internal or external, that you have to respond to. And so some of our minor stresses are fun, but they still take a toll. I was on vacation 2 weeks ago and I came home exhausted because it was a fun vacation, but it wasn't like I recharged, I refocused. And those minor stresses that you're talking about in the clinic wear on us. And so the most important thing to do is to find our coping mechanisms, the processes that we can do to kind of almost allow those stresses to move on without us internalizing them. So a couple of things that I think are very important. One is I would highly recommend that I'll say this, that you be selfish. I don't want you to be self-centered, but you have to take care of you first because you're no good to your patients, your clients, if you're not in a healthy space. And you may be able to do it for a day, a week, but over time, there are some certain signs and symptoms that we see that our patients may perceive that we don't recognize. And it could be irritability or lack of focus that are good warning signs. So I think the selfish part is when you have a lunch hour or a lunch break, take it. It is your right, it's your responsibility, but more importantly, it's your reinvestment. So I'm not a big fan of people eating at their desk or in their workstation. It doesn't actually shorten your amount of time and it doesn't get you home sooner. But getting a break to step out for a period of time, even to go for a walk here in Birmingham today was an absolutely gorgeous day. I walked outside several times over at Alabama just to feel the outside sun and get the vitamin D. That's critical. Number two is to have some time. Studies have shown that mindfulness, the simple awareness, only needs to happen over a 12 to 15-minute period. And you say, ooh, that's a long time. But 15 minutes is only 1% of your day. And so some of the things that I'll do is I'll get to the office, or I'll get to my desk here in my house, and I'll sit there in the morning before I get started for just 10 or 15 minutes and just be present where I'm at. I'm not going through any kind of high level meditation or anything. I'm just more being thought provoking and allowing myself to have thoughts that are kind of non-judgmental. The last thing that I think is really important, I learned this from a former roommate of mine who's an orthopedic surgeon. And he said when he leaves to go to work in the morning, he identifies a spot, a landmark. And for him, it's a tree with a ribbon on it. And when he passes that tree, he's doctor. He's the professional. But when he passes that tree coming back home, he's dad. And we all have responsibilities that we need to respond to. But one of the biggest stress inducers that we all have in our life is our cell phone, because it is our computer and our lifeblood. You can't just happen to search something without internalizing the email, the text message. And so a practice that we can all model is telling people and putting in your email line, you do not need to respond immediately. Or identifying that I answer emails between these times. People, if you need me, please call me directly. and I will step out because I know it's important. But if not, your urgency is not my responsibility. And if it's important, call me. If not, you will get it during my normal reply times. That's a great practice that I'm not good at. In fact, I'm terrible at, but it sounds great in theory. So if you can make it work, let us know. But it does help you out in a mental health side, because one of the stresses that we have is unpredictability and having to constantly react to things that are going on versus having a responsive pattern of knowing what's in front of us and using our resources and our coping mechanisms to respond to it.
Well, I can relate to a few of those things that you're saying. One is responding right away. I get texts constantly during the day from patients, physicians trying to get hold of me, the company I work for. And that's a really bad habit, that you try to respond right away. But the problem is sometimes those can pile up.
Oh, yeah.
And it creates more problems toward the end of the day. So my strategy has always been, I'm going to address them as they come. But I think you're absolutely correct. The other aspect is, the lunchtime. We talked about this on previous calls and webinars. I have colleagues here at our clinic in Birmingham, and they love to do notes at lunch. They sit at their desk and they do their notes. And I did that for about 10, 12 years. And I can't tell you how adamant I am about taking a break. Yeah. And just going outside or stepping away or doing something like an app. Dr. Mccabe, you want to talk about maybe an app for a second that you can kind of disconnect from the day and maybe getting into your current state, so to speak?
Yeah, I'm a fan of two of them. One is Headspace, and Headspace was started by a gentleman, Andy Puddicombe, years ago, and he was a Tibetan monk, and now is like Hollywood's right-hand man, right? I mean, he's all over the Hollywood West Coast. It's amazing how you go from being a Tibetan monk to that. But anyway, he's been a really big help to a lot of high performers. And he put together a brilliant app. I used to record visualizations and stuff like that. Look, it's perfect. His thing rocks. So I just refer people to Headspace. If you're like me, you can go on YouTube and find the first episode and just keep doing that one, or you can pay for it. And they have different ones that are specialized. There's also Calm. Calm is a brilliant app that is really good too. We don't need to be fully invested for hour-long sessions. In fact, as a psychologist now, I usually do 15 to 30-minute sessions. People's attention spans are so much less than they used to be. And, you start staying in there longer, people start looking at their phones on you. And so for me, you adapt. And I think it's looking at those things to say, wait, I need to be in a better frame of mind so that I can, that life, work don't live me. I need to be in charge and I need to get on top of it. And those things can help clear the mechanism a little bit so you can be present and focused on what's important.
Let's change gears a little bit. Let's talk about coping with difficult patients. Patients maybe not motivated, maybe not responding to treatment, and we become maybe, as you said, we're invested in this. Mm-hmm. As healthcare providers, we want our patients to get well. And when they don't get well, I know I take it personal. Maybe I'm not doing what I need to do. Maybe I need to change the treatment. Is it me? Is it them? So what can we do to stay motivated? Because I think that's one of the major reasons why there is burnout in our profession, is maybe we're not getting the success with patients or buy-in. And as a result, we become frustrated and we kind of seek other channels. What can we do for those types of scenarios?
It's a great question, and it's one that all of us are into, because there is an aspect of us that we all want to be valued and we all want to be respected and we all want to do a great job. People are spending their time, their money, and their resources and their hope on us. And so I think sometimes it's managing expectations in the beginning. Also understanding that people are not always adherent to what we ask them to do away from us. In fact, medication is only about 60% adherence rates. And they'll give you every barrier in the world, but it still comes down to they have to make a choice to use it. So when things are hard, most people change or engage because there's one of two reasons. They're so uncomfortable that they have to do something different, or the reward is so great that they need to make that change. But those are at the ends of the continuum. There's a lot of people in between that are willing to suffer for a little while, and it's just not worth the risk of leaving what I know to try something else or to give extra and not have a response. So while we are giving them everything we have, sometimes we need to understand that our patients need more education and maybe spending more time with them. So how do we protect ourselves on that? One is looking at it as I'm going to give them everything I have, but I'm not in total control of the outcome that they have. And, I think the hardest thing for anybody in a therapeutic environment is sometimes the therapist that follows us has the success, but we built the foundation for it, and that's okay. And I know that's hard, but we want to give them everything we can. And I think ultimately it's about connecting to the person and their own unique psychological, what I call a fingerprint, their own fingerprint, and realizing that it's not personal for you. It's just you're giving them everything you have. And as long as you look at it that way, that's all that matters.
We're coaches in a way, right?
Yeah.
And we're coaching them physically as well as mentally, similar to a coach in athletics. So my question is, when you're treating a patient and obviously they're coming in because they're hurting, they can't do what they want to do, they have pain. What are some strategies that we can do to encourage to the next visit or encourage to what they're doing at home? Similar to what a coach does in a sporting event. If you have failure, everyone can't win the game, so to speak, right? There's only one winner, so to speak, in a tournament.
Yeah. One of the things that I always suggest is not to forget the placebo effect. There's a great TED talk by Dr. Aaliyah Crum, CRUM, on the power of placebo. And she talked about the use of saline in pain management. I mean, we can't do those studies anymore, but they're extraordinarily powerful. And so anytime that we can provide some expectations management or even cue them in on what they anticipate and what they should see, we start priming them to pay attention. I find that a lot of times the problems that patients have is a problem of our communication. We don't give them proper expectations. We don't shine the light on the things that are important for them to take a look at. And then also we don't measure or communicate the measurements that are important to them. I always think about a patient that I had. It was a football player returning from an ACL injury. And we had shown him every piece of data possible to show his functioning was significantly better than it was before. But he had a family member who kept communicating and saying that he didn't think he was going to be draft eligible. And the family member was getting offhanded comments by agents that were probably recruiting against each other. But about a week before the season, I had told him leading into it that he was going to have more pain leading into the season than he was going to have once the season started, because I knew there was going to be some testing. And after he got through that week, he had gone to dinner with his girlfriend, and he called me the next day. When I walked in the training room, he said, "Doc, I'm back." And I was like, "Yes, you see it." He said, "I went to dinner with my girlfriend last night and I had my foot under my chair for like an hour. And when I stood up, I had no pain." Unbelievable. Because we had shown him velocity data, strength data, flexibility, all the other stuff, and he just couldn't see it. But going to dinner with his girlfriend and his legs sitting under his chair at a Mexican restaurant, that was the indicator that allowed him to believe that he was ready to return to play. I mean, it was one of those, like, you got to be kidding me. We would have gone to Mexican food a lot earlier. But
Exactly.
The truth was he didn't really believe it until some indicator inside of him said, yes, it's time. We see the logic. They don't. Yeah.
To your point, Dr. Mccabe, we see that in the clinic all the time. At least I have in my career. I can tell you you're better, but until you feel it, until you experience it in some way, we can't win you over, so to speak. So we always try to end with some type of positive movement or some type of encouragement, whatever that case may be. So I think that's a really important lesson. Speaking to that point, when we do have some difficult patients, so a lot of times therapists are dealing with people with chronic pain, chronic dysfunction, and we're trying to get them to a little bit better level, maybe not completely normal. And so it can be somewhat disappointing to some degree. Who do you surround yourself with on a daily basis? Do you surround yourself with other therapists and other people who you can commiserate with? Or do you go the other end and you surround yourself with only positive people and you say, well, they're just cheerleading, they're not really living my world? Right. Or is it a combination? What would be the best strategy?
Yeah. Isn't it funny if you go into an ICU, and I spent a lot of time in ICUs doing psychological assessment, and you're in a pre-COVID, you're in a grim, dark, noisy place, and you look over in the nurse's station or the therapist station and they're laughing about something. And I've seen a lot of times where families get upset by that. But what they don't understand is that's a coping mechanism of detachment, of the ability to walk out of the room and wash their hands and say, look, I can return. I think what's important is that anytime we're under stress and anytime that we're really struggling with things, we have to be able to dissociate, to detach from the environment we're in. And if we don't surround ourselves with individuals that allow us to detach and see life from a different perspective, we're at risk. Because apathy, which is the feeling that we're not really in power of our environment and what's happening to us, and we feel powerless, that spreads like a virus. And so if I'm feeling apathetic and I feel like I'm not making an impact, or I feel like decisions being made by administration are not supporting my causes and my ideals, if I keep talking about it, I'm probably going to find somebody who agrees with me. And now we have a common bond. And what happens is that apathy starts to grow and we start getting reinforced thought processes, and we start having a self-fulfilling prophecy or a bias of seeing those that maybe are accurate, right? There's always dust in the corners, but it's what's important. And so I think you have to have somebody that you can decompress with, and it may be a colleague, it may be somebody else, but you also need people that hold you accountable to say, this isn't the time, or you need to let it go, you need to move on, because you have to have a separation there. And so I think having those two are critical, the colleague who can help you manage what you're thinking, but also somebody who will hold you accountable to say, it's time to let it go. You need to get away. You need to go for a walk. You need to do something like that. And it may be kind of a referee style person. It's like, that's enough, time out, move on. Or in your own life to say, look, I know it's tough, but I think what's also important is when we return home is to have a reentry phase. And particularly for healthcare providers, this is really important, is telling our significant others or our partners or spouses, listen, when I return home, sometimes I just need 5 or 10 minutes to go change clothes, get my scrubs off, take a shower, and give me a chance to decompress, because the drive home is not always the most relaxing. And even if we're running out for dinner or whatever, I need a reentry phase. I'm not asking for a scotch at the door and to sit and smoke a cigar like they used to do in the 50s. What I'm saying is I just need a time to say, look, I need a moment or two just to recapture my mind. If you need to sit in the driveway, do that. But have a moment before you come in. But when you enter home, now you've been given that time. Now let's refocus, because I don't want you carrying those patients and those struggles day to day, because it'll eventually transfer back to them. And now we start having head-to-head confrontations with really subconscious kind of interactions. And we all know those feelings of somebody we're just really struggling with, and those interactions are tight and tense, and it's not easy.
Would you say it would be a good idea to discuss the day? Let the day just end?
I love journaling. I love vlogging. I mean, you don't have to publish it, right? I just love sometimes people being able to talk it out. Some people use devotionals of just a moment. Some people exercise. God help those people. But, I think there's something, yeah, exactly. They go for a run or something like that. I just don't understand that. But, you have to have your thing. And it doesn't need to come to the expense of other people, because what we often forget is if we blend those two, it's already coming at the expense of other people. So it's setting healthy boundaries. Boundaries are really, really important in any facet of our life, but it's really important when we are responsible for the care of other human beings. There's been a series of studies out of Ohio State many years ago in a field called psychoneuroimmunology, which is the combination of the neurological system, the psychological, and the immunology systems. And we know that caregivers are at increased risk of illness, whether it's viral or long-term wear down or worn down syndromes after caregiving for people with breast cancer or Alzheimer's disease. We've looked at the incidence of issues within the healthcare sector, but one of the things that happens is we either have burnout, unhealthy choices, or changing jobs frequently. And those are not all healthy solutions, because what sometimes we're doing is we're running from the solution versus facing it and saying, I need to be a better practitioner. We're all concerned in the fields about impaired practitioners. And I think one of the aspects that we're starting to study more and more is what's the impact of our mental health on our ability to be a highly productive and successful provider, maybe not fully impaired like we would be with like an addiction. However, if we are coming in every day and performing at a suboptimal level, there is some question and concern. So you have to be selfish and take care of yourself and find the things that are healthy. I will say this, one of the best pieces of advice I've ever been given by a psychologist is if you have a very tough patient, it's okay to say, I need to step out and go for a walk. And even if it pushes the next patient back 5 or 10, 15 minutes, It's better than going back in, because if you carry the stress from one to the other, you're doing them a disservice. And say, I need a moment. And if you're just honest by saying, I just need a moment to get myself back together, it's okay. People are okay with that. It's when we try to fake it, usually doesn't work, and they catch into it.
Yeah, one of the problems or situations, challenges we have as, again, healthcare providers, as therapists, physicians, whatever it is, you've got this schedule, and the schedule is building, and it's one patient after another. And so if you do something like that, it's going to push it back, and you're going to get out later, but maybe the next patient's going to complain about it. But I think, again, it goes back to self-care.
Yep.
Not to think of it as selfish, but you're actually going to do better with that next patient.
Well, and there's always the benefit of the no-show, and we all know those, and those always seem to show up and take care of some of those issues. But the reality of the fact is that our schedule, we're not on a production rail. We are human beings, and we know that certain medical professions in the physician's world is higher burnout, ER, things like that, because they never get a break from the and therapists, like physical therapists, occupational therapists, PTAs, they're at risk too, because we're not always seeing highest functioning, and we don't always see the entire circle and the entire sphere, and we don't actually get to see people come back, because if you see them again, they're having issues, but if they're successful, you may not ever see them again, and you don't actually get to see the success that they have in their life. Now, sports, we may see it because we can celebrate somebody's return to play. It's probably why me and you and we love the sport so much, because we can see that full arc. But sometimes in life we don't see that, and people don't send thank you notes. They don't send follow-ups and things like that, and so we have to assume that they're getting better, but we don't always have that immediate connection to it.
Yeah, you spoke about burnout, and I think you had already some key points as far as trying to prevent burnout. But are there any other thoughts about preventing burnout in this profession?
I think the number one thing that we need to do on burnout is to always find a challenge. So, if you can find the interest in your profession, that's wonderful. I think one of the things that happens to a lot of healthcare providers is training is often very enticing. It's very engaging, it's very educational, and it doesn't always mimic what real world is. And so we have to keep that interest and stay engaged. And even if we're volunteering to teach, even if we're training young students, there's a spirit of growth that happens there. So find the thing that helps you avoid the burnout. Burnout's real. It happens to every one of us. And I think the other facet of it is don't be upset if you feel burned out. Use it as a trigger. Don't use it as a warning sign. And the trigger is, I need to do some things right here, and I need to be aware of it. I think one thing that's interesting is, if you probably looked at seasonality, this is usually a time when people start getting burned out in the fall, because it's tiring. You got football is much more active, but just by nature of seasons, the fall is the dying off time. It's getting darker and darker, faster and faster. You haven't quite gotten into the holiday rush, but spring is rebirth. It's regrowth, and there's the nice warm days that happen that we feel energized. So be aware of the risks that happen there. I interviewed for a fellowship in Minnesota and Rochester at Mayo, and I got off the airplane. So there's no way, I'm gonna be up here. I can't do this. It was dark at 3 and minus 400 degrees. I mean, it was just no way. And so you have to know what makes you tick and what doesn't make you tick. And I think there's a question on here that I think is important about that is, what do you do when your colleagues are bringing you down? Because that is also a sign of burnout, and you got to be careful. I have a new book that came out called Break Free from Suckville, which is this idea that we're always falling short of what we want. And one of the components of that is, who are the other residents of Suckville? It's the naysayers, the better off the other ways, the active complainers. We have to be careful. We don't have to buy in. Even if they're people that we love, we don't need to share in their misery because they've invited us. We have to be careful and to say, I don't need to be around them right now, and I need to limit my interactions and engagements. And sometimes putting up those boundaries is critical. And just to say, I just don't need to go there. We just don't need to have that conversation right now. And it may cause a little ruffling of feathers, but in the long run, you got to take care of your own mental wellness.
There were some key points there. As far as burnout, I've been doing this for 37 years now, and pretty long days each day. And there's occasionally where I'd say I feel a little burnt out, when mentally and physically you're kind of run down. But I think if you're one dimensional, meaning all you're doing is seeing patients, I think you have a higher risk personally. I may
Yeah.
be wrong on that.
No, I would
But
agree. You need variety. You need
yeah,
variety.
because I try to be personally, just retrospectively looking at myself, we do research here, we teach courses, we do these webinars. And so it's ever dynamic. There's students, we have 3 students here now. So I would urge the professional people on, by being involved in your profession, be involved in teaching, clinicals, and research. And research doesn't have to be a double-blind, prospective, randomized trial. It can just be looking retrospectively at your patients in a particular domain and saying, hey, when we see these patients, this is what happens, and maybe we can change that. So it's just clinical research, and there's nothing wrong with that.
No. Anything to, the mind gets bored very easily. It wants variety, it wants uniqueness. Anything that we can do. And look, the benefit of what you guys do for a living, the benefit of what I do for a living is ultimately we're critical thinking degrees. We're critical thinking professionals. So if we allow ourselves to get caught in the rut, then we're giving in to the stresses by saying, this is all I can do. Look at it and challenge it, and look for different ways to do things differently, because the way it's been done doesn't always need to be the way it's going to go forward. But it doesn't mean it has to change immediately, but just look at it from an interested observer standpoint. Being interested, I called somebody the other day and I said, it was an athlete, but I said, let's be an investigative explorer, like you are a tourist. Sometimes we need to be a tourist in our own life. And when you go on a new city, you're taking it all in and it's really interesting. Sometimes take a look at what's going on in your own clinic, because we get so regimented in what we do that we ignore people. I left the other day, and in Birmingham, I drove down to Jacksonville and I drove back 7 hours there, 7 hours back. And I left at like 3:30 in the morning. And I was one of those mornings, it was a weekend. I was like, whew. But I stopped into a gas station, and the lady that was working behind the counter, as I was walking out, she said, you didn't say bye to me. And I stopped and we had a conversation, but her presence at 5 o'clock in the morning was so bright. Her smile, her communication, it changed my entire day. And so sometimes we have to be open to what people are willing to share with us around us, because it would have been so easy for me just to keep my head down and keep going. But it was like, that was a slap in the face of, here's somebody who's working at 5 o'clock in the morning. She'll never see me again, but she chose to try. And I'm so thankful she did. It doesn't take a lot just to be engaged in the person. I would also challenge you to find out something new from your patients each week. Try something new by asking them some questions, because ultimately at the end of the day, many of you are not just physical therapists. You're also psychological therapists for your patients. And they bond with you. And those tables are, I wish I had those tables in my office. They're almost like truth serums. They bring out the emotions and the sharing and things like that. So don't forget that they're in a very vulnerable state. And sometimes having that conversation with them, just that emotional connection, can help you just as much as it does help them.
Absolutely. That conversation is therapy. Talking about their fears or their concerns.
Yeah. Or even something on Netflix.
I have that. I never look at it though.
Yeah. It's
hey,
good.
what about students? Students have it a little bit tough at times. So to get in physical therapy school, you got to have a high GPA, right? Most of the time programs aren't going to look at you unless you have a high GPA. So there are already these overachievers and, very driven, highly motivated individuals, self-starters and so forth. And then maybe they're thrown into a clinical situation like here and, maybe a little bit overwhelmed at times. How do students struggle with these situations when they realize I don't have all the answers, perhaps, for first time?
So I'm going to sound like an old guy, but this generation, so I'll just say that. But remember, every generation is different than the previous one. So I'm not saying that in a bad way. This generation is the most technologically savvy and fastest thinking group we've ever seen. But at the same time, y'all are also the most impatient, because there's a part of you who are so good and so successful for so long, solving problems very quickly, that we often forget that sometimes the challenge and the complexity of the problem in front of us is a challenge. It's not a reflection of our shortcomings. So if we have to work through to find the answer, that's okay. You don't have to have all the answers. It's like solving video game levels. As you move up levels, you have to learn new skills in order to achieve and overcome them. We need to look at them that way. But because we're high performers and because we have high goals, sometimes we get into the reality of the outcome, the end, and we go, this is all it is. Or I need to learn how to succeed here, because we've been driven to advance for so long that now we have to be driven to learn, to experience, and give ourselves the grace. It doesn't mean that your clinical preceptors or your professors aren't going to be hard on you. That's just part of it. They're going to be demanding, but it's not personal. It's developmental. So look at it as, I am doing everything I can to learn and to grow. We all have been in training where we can look back and say, ooh, that was a wake-up moment that I wish I hadn't experienced, but it was the best thing that ever happened to me. And while it hurts, it's not fatal. If you keep working to get better, you keep investing in learning to make your field, your experience better. Now, that all being said, I'm an outside the box thinker. I've never been the conformist when it came to psychotherapy, psychology, and stuff like that, because I always saw that there are other ways to do it. Don't be afraid to express that and find mentors that challenge you, but also maybe share some of the same ideas, and then share the opposite. Don't be afraid to reach out for help. Don't be afraid to reach out for information. I don't know many people who are in their position that would turn down a chance for coffee or breakfast on their schedule to sit down and have a conversation. We want people who are engaged and interested and have a thirst for learning and a thirst for experience. And so as a student, don't ever forget that. Don't forget that you can learn from people who are in, sometimes your front desk person may have a lot more knowledge than you understand. Listen to them. They may have an answer for you, and get to know them and see those different things as a student that are out there.
You touched on it a little bit. What about the other side of the coin, the clinical instructor? So the mentor for the student. What are some ways that we can motivate and encourage
The clinical instructor or the student?
The clinical instructor to the student?
Yes. Or, do we need to motivate the clinical instructor?
Sometimes.
You know what? I think challenges are great, but here's the thing that is always important. Okay, once again, this generation doesn't like surprises. We're not shocking them by surprising them. Instead, to say, hey, in the next 6 weeks of our preceptorship or whatever, there are going to be some challenges that I'm going to put in front of you, and I want to see how you respond. So go ahead and let them know that here's the challenge, and come up with some unique opportunities, and don't feel like they're a burden. One of the things I always do is look at the innocence in their eyes, because you were in that position at one time too. So as a clinical instructor, you're building the next generation. So what are they taking from you forward? They are going to reflect a little bit of your lineage and everybody that they treat going forward, as well as educate going forward. So what's the footprint that you're in that situation? So create some challenges and unique opportunities for them, but also don't be afraid to learn as the evolutions are coming, and abandon the ways that you've always done it for new innovation. Because sometimes the students have some really interesting insights because they see things from different perspectives. They see it from not being, standardized for so long in a central way of thought, that they have a very unique way of doing it. I remember when I first came out into practice, it was the start of the new, electronic medical records. And it was always funny to look in the hospitals of who was the adopter and who wasn't. If they had a BlackBerry or a Palm Pilot, they were EMR people. If they weren't, if they had their pen in their front pocket, there was no way in hell they were going to use an EMR. Now everybody's been trained that way. And so it's almost universal. So I think it's looking at those different things to realize that there are some fun ways to do it. I had a friend of mine who was a neurosurgeon, and he listened to rock and roll while he did surgery. And people used to freak out like, oh my gosh, you're supposed to listen to classical music. He's like, that's not relaxing to me. And be a unique presentation of yourself. I mean, we have some social norms we have to do, but don't be afraid to bring your own flair to it as a clinical instructor or as a student as you grow up. It's okay. That uniqueness is wonderful. It really is. And my gosh, if any time in our world right now is the time to be an individual expression, is wonderful.
Yeah, to your point, I've had so many students that have taught me so many things. I mean, I've converted to PowerPoint because one of my students taught me how to do that years ago from slides. I thought I'd never give up slides. Right. He said, man, you're so archaic. You got to get with it. Same thing with social media. I had another student that pretty much shamed me into it. Then I see the advantages of it. I've had other students teach me different forms of exercise and mobilization techniques and manual techniques. I mean, we're learning from each other, correct?
That's what it's all about, isn't it? And I think, asking people, even students, how do you de-stress? Younger kids, they like to hang out, a different way than we did, right? Yeah. And it's on the phone, and don't be afraid to communicate that way. I know there's limitations how we communicate with our patients, but don't be afraid. Not everybody likes to pick up the phone and have a conversation. I think the greatest innovation is voice messages from your answering machine or your answering machine on your phone. I don't want to be surprised. I hate being surprised in any way. So I can read what the message says before I have to listen to it. And that helps my anxiety, right? But I also tell everybody, if you need me, don't send me a message that says, call me, we need to talk, because I'm going to think of the 10 reasons why I've upset you before I literally had a call from one of my players. Can we talk? And I was like, oh man, I'm getting fired. No, he was having a meltdown on something and he just needed some help. But that's where my mind goes. So the things that help me is I kind of educate the people I'm with. Like, don't call me and not leave me a message. If you're going to call me and not leave me a message, send me a text on what it was, because I will think you're dying on the side of the road. And now I'm distracted because I'm not going to answer it when I'm with a patient, and I'm going to try not to look at my phone, but sometimes it happens. So don't be afraid to, set those rules up to help self-care. It's really, really important.
Yeah, to your point, I think it's a trend now where people call you and do not leave a message.
Yeah, no, that's
I
torture.
get that more and more. Yeah, it does.
That's
Even
torture.
my family does that. My kids do that to me. And I'm like, was it a accidental dial? Another term often used, but or was it, like you said, some problem or something like that?
Well, the other one that gets me, now I sound old, is those little voice text things that I have to listen to, because now I have to put the phone up to my ear. I can't do that when I'm with a patient. So now that drives me even more crazy.
Right.
Just give me a chance that it shows up on my screen. I can read it real quick and realize it's not a problem.
As we wind down, again, for the participants, please type in any questions. I mean, we have a fantastic.
Let me say one thing. Let me say one
Sure.
one thing here. And this is important, I think, with what we've gone through with COVID. COVID is the American Psychological Association did a survey. They do them every year. But 2020, 2021 are the two most stressful years we've seen on record. It's impacting every one of us. There's some slow grifting. There's some slow erosion that's happening into all of us. There's also the big stressors, the unknowingness, the uncertainty, the mandates, administrative decisions, job security, all those things are really important. The way you think, the way you experience. Right now, suicide is actually on the, I want to say it's on the rise. The number of people who die by suicide is increasing. One of the things that we have done in psychology is we've changed our terminology from committed to died by suicide, because it is a reflection. And we have a responsibility, even you. One thing I would always recommend to people in every medical clinic is to have a plan in case somebody comes in is in that situation, because we don't want to marginalize them or stigmatize them. We want to open those conversations. If you're suffering from depression or anxiety, if you're suffering from thoughts of harming yourself, that's not, I don't want to say that's not abnormal, but it's a sign that let's reach out. There are professionals, just like for what you guys do. That's what we're here for. Now, unfortunately, my field has brutal access issues. Okay. But you have to be persistent. Don't stop. Keep calling. People will get you in, but don't stop on not helping yourself. Negative thoughts, worthless feelings, feeling like you're not making a difference, those are normal. There's no manual anywhere in this world that tells us what the right type of thinking is. So many people feel like the way they think or what they perceive is actually a problem. It's not. So what you feel, the biggest thing we can do is just not judge our thinking and just say, I need to listen to it, versus why am I thinking that way? Or am I wrong for feeling this way? You're not wrong. How you feel is how you feel. So that's people, it's mental health, mental wellness, mental illness are equal opportunity offenders. And the days of gone of not saying anything is a sign of strength. We are seeing across all the sports and business worlds that reaching out for help and having somebody there to communicate with. I am trying so hard, and every soapbox I can get into is that we treat mental health like we do going to the dentist. You get 2 visits a year. Every 6 months you get to check in. It's completely bogus that it's a third party thing, but it needs to be that way. And most of us have access to professionals like me even just sitting down and having lunch. I know I'm not doing psychotherapy if you sit down and have lunch with me, but just somebody who's like, it's okay to think like that. It's okay. So,
As you know, my daughter is a counselor, so it's
yes.
dear to my heart. So lastly, what are 2 or 3 tips that you can leave us with that lead us to a happy, productive, and very satisfying, well-balanced life?
I don't know about a life. Boy, that's a big one. That'd be a great
Life
book.
plan.
Life plan. Be a learner first. Okay. Be an active learner. If we're getting stale in what we're doing, we need to look at it from a different perspective. I think ultimately learners are winners. The more we can learn, the more that we're thirsty. At the end of the day, I want our life to look like our bookshelf. There should be sides in there about cooking and travel, and there should be sides about psychology and physical therapy and the body. And it should be don't be afraid to read a novel. I'm finishing up an audiobook. I hate audiobooks that are based in my field. So I like to listen to spy thrillers. So be a learner and experiencer. So that's wonderful. 2, set stakes in the road, set sub goals. And if it means, hey, I'm going to book it until I get to that vacation, that's great. But have targets that you want to achieve. And it's not always about achievement. Okay. So don't be afraid to set some standards like that. That's a carrot that I can go to. And the last one is we do need to flip life a little bit. Sometimes we let life live us, but we need to start living life. Every patient that we meet, every person that we come across has a story. Try to find out what those stories are. Look at life and look at experiences. Sometimes we judge, and I teach my athletes to take a look at when they travel from a different perspective. We go travel and you ask a student athlete, you say, who's the one that ensures your hotel stay is good? And they're like, oh, the general manager. It's usually the maids, the housekeeping staff. So nobody ever talks to them. And sometimes if you just say, hey, how you doing? And pick up your towels and put them on the counter so that they don't have to bend over. Those little things of engagement and excitement and enjoy just to connect to somebody else are really helpful. So allow yourself to be that, to live life and get a little bit ahead of it. If you feel like it's running away from you, take a deep breath, ask for help. Let us help, reorganize and schedule, but don't feel like life's running away from you.
To your point, I took in a webinar a couple of weeks ago from New York University, Legon Medical Center. They were talking about Alzheimer's and some strategies to prevent cognitive atrophy and things of that nature. And to your point, it's learning something later in life completely opposite, or not opposite necessarily, but totally different from your domain, so to speak.
Yeah.
So if you're a doctor, step out of it, learn a language. If you're a doctor or a therapist, learn cooking or something like that, but something completely different that's stimulating different centers of your brain.
Just don't own a restaurant. They all fail. Everybody in the medical field thinks they can own rest. Don't do it. There was a good question here. It mentioned varying your practice, but also understanding that we all have practice demands from upstairs and the bean counters or the suits and things like that. I think some of it, how do you start the personal professional growth types? Don't be afraid to have brown bag lunch meetings and saying, bring in a speaker if you can, but just, once every other week, just have, maybe it's an internal, and it doesn't have to be a book club, but just, hey, everybody brown bag it. And we're going to have a meeting in the lunchroom if we can. Every clinic's different, but if we're closed from 12 to 1, we're going to have a meeting and we're going to go on time. We're going to talk about some different topics of personal development. And it takes somebody to take that charge, but look for creative ways. It could be in the morning. It could be, find some ways to do it. And you may be shocked about how it can happen. Of finding new ways to build professional growth and program and activities. It could be as simply as an exercise challenge within the employees. It could be, how many miles can you walk, or, investigating new, having a chili cook-off and everybody brings in something that they cooked, something that just is, look, kindergarten teachers probably should run this world because they have always found a way to keep 5 and 6-year-olds engaged in something. We are no different. We're just bigger. Okay. And we probably don't have as many accidents. So let's just try to get back to the ribbons and the fun and the token economy stuff, which really still works. People love to win. You can print out a certificate off of a printer and people still value it just as much as a $25 Starbucks gift card.
Plus we have patients that have the attention of a 5 or 6-year-old. So we have to keep them very much engaged at times.
Yeah. Yeah. It's fun, and don't be afraid to have fun. I learned that a couple of years ago. I was trying to always be what everyone else in my field was, and being a nonconformist, I was like, look, I'm just going to wear shorts and, golf shirt. And sometimes I'll see people in sandals. I don't care if it makes them more comfortable. It makes me more comfortable. And
Yeah, if you want to
yeah.
decrease your cancellation rate or no-show, make your treatments a little bit fun.
Yeah,
It makes a big difference. I learned
absolutely.
this later in my career for sure.
It's funny
Drew?
at Alabama, the virtual reality based rehab stuff, the kids are in there all the time.
Yep.
It's crazy.
Drew, any questions or thoughts as we wind down?
Yeah, as we wind down, right? One thing I just want to tell you guys that are tuned in today, right? Uh, you have an opportunity to kind of take these things that we're talking about and share some of these points with your colleagues out there. And if you're tuning in on this after the fact, there's no reason you can't share this, right? Like I got to go back to one of the very first things you said. I'm still stuck on is that 15 minutes is 1% of my day.
Mhm.
Like I actually got on a calculator. I was like, that can't be right.
Am I right?
Right. And then I just sat here and I thought, and I was like, so you mean to tell me, Drew, you can't give yourself 2% of your day for lunch where you're not
Right.
staring at a screen?
Mhm.
Like, of course I can, right? But I just, when you frame it and you start thinking about it, and I think like, okay, like my sanity is worth 2% of my day.
Yep.
Like, not asking for a lot. So I think all these things that you've been talking about, and I think the thing that our PT family specifically, right? Like you said, Kevin, we're such overachievers by the nature of who we are, and we're such pleasers that I think a lot of us, once we get to that point where we're just seeing people on the schedule day after day, week after week, and when you fail to have that that critical thinking and that curiosity and interest has come down, I think that's when you're at most risk for burnout, right?
Yep.
And it's not that you need to leave the field, but like you said, Dr. Mccabe, you need to challenge your thinking, right? You need to
Yep.
maybe you need to pursue another subspecialty, or maybe you just need to dig in and, like you said, do some retrospective analysis. I don't know, whatever your thing is, but
Yeah.
like that curiosity, I think that has driven us right to get to that point. And like you said to the video game players, it's like I got a 16-year-old, right? And his biggest frustration in life is when he finishes something, is like, that's it. That's all
Yeah.
there is. Like he just spent 100 hours doing something. He's like, yeah, that was terrible. But then he'll
Yep.
go back and do something, right? So I think that we have to stop with this feeling of like, this is it. This is all my life is just, 12 slots a day, hoping there's a no-show somewhere, right? Your
Right.
life is more than that, right?
Please be around 11 o'clock or 5 o'clock, please. Yeah.
Right.
The 1 o'clock no show just drives me nuts. Like, oh, could have enjoyed my lunch. Yeah. Right.
Yeah. So I just think that there's so much information here that is just, it's nice and easy, right? It's nice to have these conversations. And I think that we don't do it enough. Right? And I think that we need to be advocates of that and to
Yeah.
make sure, well, we got one last thing here from Hillary. Hey, great, right?
Thank you.
Hillary sharing that, right? Absolutely. So I want to thank you guys for taking the time to do this, right? I want to thank you guys for being a voice and an advocate for us when we know things are hard, right? We know that burnout's real. We know that people are struggling with their places in the profession, and so we very much appreciate it. So everybody, thanks for tuning in today. Thank you for joining APTA's Fit for Practice webinar today. If you're viewing this recorded after the fact, please feel free to share it with whoever it is in your ecosystem, right? Anybody, no matter what you do, this is great information. So thanks everybody. Appreciate your time.
Thank you.
You guys have a great night.